Doctors across the country have declared a national emergency when it comes to kids' mental health. Part of that concern comes from an increase in eating disorders due to the pandemic. Children's Healthcare of Atlanta reports a steady increase in those being treated for eating disorders, from 108 hospital admissions in 2019 to 174 in 2020 and 195 admissions so far this year. But getting help can be easier said than done. Liza Lucas introduces us to one group hoping to be part of the solution.
I've been working in eating disorders for what feels like my whole life. I was diagnosed with anorexia at 10 years old, struggled throughout my adolescence.
Christina Saffron is not alone. Nearly 30 million Americans will struggle with eating disorders in their lifetime. But getting treatment for this and other mental health issues is not always easy. According to nonprofit Georgia Voices, a lack of mental health providers is one of the most significant barriers to getting help. 45 of Georgia's 159 counties don't have a licensed psychologist or a licensed social worker. And while recent investments have helped access, 2 out of 5 kids in the state still struggle to get treatment. The gaps in care, not unique to Georgia, and part of why Christina and Dr. Aaron Parks formed Equip, a telehealth company providing eating disorder treatment online for kids and young adults. It's a 5-person care team available virtually.
If you are going to drive to all of those appointments, that's going to take up a big chunk of your week. And that's time that a kid should be in soccer practice, at Boy Scouts or Girl Scouts. And so Equip and being telehealth allows us to have families arrange treatment around their schedule instead of arranging their family around treatment.
For more info, we checked in with Dr. Linda Craighead, professor with Emory University who specializes in eating disorders. She says the pandemic has further highlighted the benefits of telehealth.
I think there is something kind of unique about the ability to reach people in their own environment where they're maybe more dealing with the issues right at hand and are feeling a little more comfortable about talking to them.
While treatment is not one size fits all, she says telehealth like Equip can be valuable tools, especially for teens.
And that's what's really important about all psychological health, is to have many options. Eating disorders is one of the areas that badly needs this extra access.
Cost of treatment can also be a barrier to getting help. Equip recently expanded services to Georgia and partners with several insurance companies with plans to add even more. Meanwhile, Emory launched their own app on mindful eating. We've got much more info for you online at 11alive.com.